Welcome, members of the press. Yesterday, the World Health Organization raised the level of the influenza pandemic alert from phase 5 to phase 6, signifying that we are now at the start of the 2009 influenza pandemic. As of today, 74 countries have reported greater than 29,000 cases and 145 deaths. Moving to phase 6 will not imply that there will be increased rates of deaths or severe illnesses. Most people, as we know, have relatively mild illness and do not require medications. But we must not be complacent. We must continue to monitor the situation. We must also be prepared for a second wave and, above all, strike the right balance between overreaction and complacency. WHO continues to recommend no restrictions on travel and no closures of borders. We believe that this pandemic will be of moderate severity, though this could vary among countries and over time. Again, the vast majority of cases who are infected have a self-limiting illness with full recovery, often without medical treatment. Moderate is an indication of the pandemic's impact and takes into account factors other than the virulence of the virus. It considers vulnerability of local populations plus the resilience of local health systems. Moderate also means that transmission of this new H1N1 virus is more rapid, and severity of cases is also increased relative to what we see with seasonal influenza. But seasonal influenza is definitely not the common cold. Seasonal influenza on a yearly basis produces anywhere between 250,000 to 500,000 excess deaths. Hospitals and healthcare systems in most countries generally have so far been able to cope with the numbers of people seeking care. Although in some localities, we do know that some facilities and systems have been stressed. In countries and communities with a high prevalence of vulnerable populations and limited resources, we do not know how this virus is going to react. However, preliminary evidence suggests that the virus exerts more damage. So what do we additionally know about the behavior of this virus so far? The new H1N1 virus infects the usual risk groups that we see for seasonal influenza. The major differences that we see, however, is that this virus disproportionately infects younger people. In nearly all areas with large and sustained outbreaks, the majority of cases have occurred in people under the age of 25 years. This is something we usually don't see with seasonal influenza. Most cases of severe and fatal infections have been in adults between the ages of around 30 to 50 years of age. And this is again a different pattern from seasonal influenza, when most deaths occur generally in the elderly population. In some countries, we know around 2% of the cases have developed severe illness requiring hospitalization, and a smaller percentage rapidly progress to life-threatening pneumonia. Although difficult to measure because of the challenge of having accurate denominator data, the case fatality ratio from experiences such as Mexico, the United States, and Canada, and other countries indicates that this ratio is less than 1%. 1/3 to 1/2 of the severe and fatal infections are occurring in previously young, healthy individuals. The other 1/3 to 2/3 of severe cases have occurred in people with underlying chronic conditions. Based on limited preliminary data, conditions most frequently seen in these severe cases include respiratory disease, especially asthma, cardiovascular disease, diabetes, autoimmune disorders, and obesity. Pregnant women are also at risk for complications. How should countries react to the declaration of Phase 6? Countries should continue what they are doing to revise and strengthen their pre-existing national pandemic plans so that national actions taken for this pandemic are sustainable and appropriate for the local conditions and for the severity of the pandemic. Phase 6 for countries of the Americas really signifies that we are going from an emergency response to a response that's sustainable over a greater period of time. And really, in all reality, we've been doing this, working under Phase 6 conditions for some time now. But we should recognize that most pandemics last years. So this is not a sprint. This is a marathon. The appropriate public health responses will be different for each country. Countries must mount a response that is appropriate to the threat they face at any given time. National efforts should focus primarily on mitigating the health and social impact of the virus, rather than on attempts to contain transmission. This includes increasing surveillance and laboratory capacity, prioritizing efforts that will ensure patients receive prompt, high-quality health services to minimize mortality and the deaths that may occur, treating the sick. Countries with widespread transmission should place high priority on the appropriate management of sick patients. Health systems should prepare to manage higher volume of cases and potentially more serious cases of illness. It's normal for communities to be anxious. There is a normal period of adjustment during which the public gets used to this new threat. But again, countries of the Americas have already been in this process of getting used to this new threat for several weeks. Countries should make active communications a part of their strategic response by providing accurate and up-to-date information on issues such as pandemic activity and actions being undertaken by the government. WHO has recommended that manufacturers finish production of seasonal influenza vaccine for the northern hemisphere, which they are very close to doing, and then move on to prepare for full-scale production of this new H1N1 vaccine to ensure the largest possible supply of pandemic vaccine in the months to come. WHO is working with member states and vaccine manufacturers to ensure that the developing countries have access to the pandemic vaccine at affordable prices. In the Americas, for vaccine purchase, we are fortunate to have the PAHO revolving fund with 30 years of experience responding to public health emergencies and crises, much like we're experiencing with this pandemic. I think most would agree that the revolving fund has a track record of equity and access that is perhaps unprecedented around the world. Thanks to the genius of the founding father of the revolving fund, Dr. Ciro de Quadros, and the current high-level leadership of Dr. Mirta Rosas, the revolving fund will continue working on behalf of member states to ensure equity and access to life-saving vaccines for this pandemic. There should be no doubt with anybody in the region that the revolving fund is committed to ensuring any family of poverty, regardless of race, religion, or where they live, will have a fair chance of protection from the adverse consequences of this pandemic. Pending the availability of vaccines, PAHO and the revolving fund are also working to ensure equitable access for countries to antiviral drugs. We are encouraging, as usual, the non-pharmaceutical measures that individuals and families can take, especially the frequent hand washing, the covering of sneezes and coughs with a tissue, and staying home from work or school, and delaying travel when ill. We have made an investment in pandemic preparedness over the last 5 years, and we are now seeing the benefits as we track these cases globally. We have a good idea of its spread by good surveillance and investigation. However, the virus can change, and we have no way of predicting that. We will not know ahead of time. We have to guard against complacency, and countries will need to strike the right balance. I'll stop there and answer any questions.